really hard to find, and this study just dropped in 2024, so I thought it would be really relevant to drop out for everybody. There's a study, and it's titled Comparing the Efficacy of Varied Dextrose Prolotherapy Concentrations in Treating Osteoarthritis of the Knee, a double-blind randomized trial. It's really hard to find that double-blind randomized trial. And so I thought it was super relevant because what they evaluated in this study was a 12.5% dextrose concentration versus a 25%. And I'm going to give you guys papers too. Yeah. So what we now have in the literature is a study which actually looks at varying concentrations. We're not comparing perineural to, or we're not comparing PRP to Prolo. We're actually comparing differing dextrose concentrations. And so I just wanted to briefly read off that the summaries, basically. So the highlights of this study were that there were 60 participants aged 40 to 70 with knee OA, and they're randomized into two groups. Baseline characteristics of them all were the same. And so they did an evaluation at 12 weeks. What they noticed was that there wasn't really a statistically significant decrease in pain and an increase in functionality. The group with the 25% did fare a little bit better, but at the 24-week and the 48-week mark, it was pretty statistically significant that the 25% dextrose concentration group actually fared a lot better than the 12.5% dextrose concentration group. And kind of highlights on their methods, they did injections at 0 weeks, 3 weeks, 6 weeks, and 9 weeks. Like we said, 60 participants. Obviously, it's not a huge sample size, so if we could increase that, it would be really helpful. But yeah, I had a couple thoughts just really quickly on maybe why we are seeing that. And I'd like to draw a lot of our attention back to the healing cascade and how a lot of times that collagen deposition doesn't end up happening until months or even multiple months later on. So I think that's something we really need to consider in this evaluation, is that the reason those higher concentrations are not seeing the effect until later on is because it takes a long time for collagen to be laid down. It takes a long time for it to form. And so while I think we're increasing patient compliance and maybe lessening the blow of kind of like the pain flare after a prolotherapy treatment, I do think we're actually lessening the efficacy long term. But that draws into attention very important points about patient compliance and understanding treatments, because patients, if they don't understand that it takes a long time for that collagen to be laid down, they might associate improvements they have, months down the road to something else. Maybe they did another lower level physiotherapy modality months or even years down the road, but really they were laying foundation with dextrose prolotherapy.